Muted.
Okay,
Yeah,
I'll start with the meeting, sir.
Yes.
Good morning. On behalf of Young Psychologist of India, YPI, I welcome you all for today's session. YPI is an initiative to connect psychology communities across the globe for knowledge sharing, professional growth, solidarity, led by a guide cum mentor, Dr. Toshedra Dwivedi, Senior Assistant Professor, Applied Psychology, Amity University, Noida. Before I proceed further with the introduction of our esteemed speaker, I will pass it over to Dr. Toshedra to speak a few words.
Yeah, thank you so much. Sheru ji, and once again, good morning, all the viewers. Warm welcome and a very affectionate good morning to Saket Rai, who is our resource person today, and he's a renowned hypnotherapist and has done a lot for healing, well-being, and illumination of the young psychologists, young healers, and therapists like we all. So, on this note, I welcome Saket. I welcome I also welcome all my volunteers of Young Psychologist of India, uh, uh, including Sheru ji, Reeba ji, Alok ji, NP Singh sir, Seema, and all others, because of which this initiative is growing up in leaps and bounds. And the purpose of this platform is to share, to make a difference, to make a positive difference, to help others, to enable others to heal and bring about a positive change in the society as a healer and therapist. So I won't take much time. I know a lot of people are waiting over there. So once again, I welcome each and every viewers. There are a lot of more people who will be joining soon, and there will be a lot who will be seeing this recording of this video. So once again, I wish everyone a very warm welcome and a good wishes for the session. So welcome Saket ji once again. Namaskar. Namaskar. Over to you.
Thank you, sir.
Sheru.
Okay, let's get started. Today we are here to listen to this talk, Hypnosis, Myth and Reality. The power of hypnosis in therapy. Guys, can you keep everyone? Can you be on mute?
People all are requested to keep yourself on mute so that we can proceed smoothly. Yes, go ahead, Sheru.
Okay, so as I was saying, today we are here to listen to the talk, Hypnosis, Myth and Reality, the power of hypnosis in therapy. We all have been fascinated by this topic at some point or other. Whenever we hear hypnosis, we have a figurine of someone using a crystal ball. However, hypnosis is more than this. When I was researching on this topic, I found that hypnosis is as old as time and has been largely applied for centuries in different form. It is said that Mozart composed some of his best tune while in a hypnotic state. Albert Einstein's theory of relativity was born during one of his self-hypnosis sessions. Recently, hypnosis is commonly known as an effective therapy to eliminate smoking, lose weight, and gain confidence. Now, to help us understand and demystify this topic, we have with us an eminent personality who needs no introduction in the field of hypnosis. A man of many trade, a man of many talent, Mr. Saket Rai. Mr. Saket Rai is a certified, experienced, and a passionate clinical hypnotherapist, teacher, a successful entrepreneur, author, software engineer, a keen learner, an accomplished writer based out of New Delhi. He has over 15 years of experience in hypnotherapy and energy healing. He is a certified clinical hypnotherapist from Indian Institute of Hypnotherapy. He has to his name a professional diploma in hypnotherapy from Jacqueline Hypnosis Academy, UK. His area of expertise include master trainer in the area of hypnotherapy for individual and corporate, clinical hypnotherapy, counseling and mental wellness, past life regression therapy, crystal healing, NLP practitioner, and many more. Saket sir has many accomplishments to his credit, and some of them are: he has trained and awarded certificates to hundreds of students in level 1 and level 2 courses of hypnotherapy. He has trained corporates under the program, The Subconscious Aspect of Business, with hypnosis as the focus. He is the founder of Inside the Mind, where the quest is to curiously look, evaluate, dissect what's inside the mind. He has authored and published 2 books on hypnotherapy. He has come up with many guided mediation and hypnosis script and narration. He is the founder and CEO of Katabatic Automation Technology Private Limited, a company providing hardware and software services. And now, before we dive into today's session, some key points to note and follow. The session will be for an hour, which will be recorded. The session will be divided into 2 parts. First, talk by our esteemed guest of honor, followed by question answer session. Requesting all the attendees to keep yourself on mute throughout the session. In case you have question during the session, please feel free to post it in the chat box and I will request sir to answer them towards the end. Now I will hand it over to Saket sir to take us through the world of hypnosis. Over to you, sir. Sir, you're on mute.
Yep, that's one phrase that we've been hearing throughout when we're using Zoom virtually. Physically, it's very impossible to put somebody on mute, actually. And I would take this opportunity, first of all, thank you everyone for having me here, especially Dr. Dwivedi. And without him, it would not have been possible. The second person without whom this would not have been possible is Ramya. She is one of my students. She was interacting with Dr. Dwivedi and this happened. So many thanks to her. Thanks to Ms. George, Mr. Rastogi, because they coordinated really well, made this experience easy and smoothing. And many thanks to Sheru for saying so many nice words before I started this presentation. That really gives boost to my confidence. What I'm going to do is take you through a typical session. I have a presentation which I'll share with you guys and you have access to it. You would have any questions, you can ask now. If you have any questions, I would encourage that you can get in touch with me later on too. And to the best of my abilities, I would try to answer it. So my presentation is basically divided into 2 areas. The myths and realities that usually are surrounded around hypnosis and the power of hypnosis in therapy. So I'll give you a bit of background. As Sheru rightly pointed out, it's been in use since ages, even before hypnosis was actually recorded as being done. The myths and realities, some of them may be real, but most of them are myths. Use of hypnosis in therapy, how exactly you do that. Applications in some of the areas. The area is wide, but I'm just picking up some of those which are quick picks. And a brief experience on hypnosis, how easy it is. We experience it daily. And formally, how to do it. History of hypnosis, as we look at it, it started even beyond when the Western world started recognizing it. The Egyptian have something called Temple of Sleep, where people were put to sleep and they would come back healed. There were shamans who would use drums and other forms of dance. The Sufis who whirl around and get into a state of trance. Now, that would ask us, that would take us to the question, what is trance? And we'll definitely come back to it. But this, some of the milestones, and this is very sweet, to the point that it's the Western world view. In hypnosis, if you look at an Indian context, probably the words, the curses, the power of the words were used by sages all along. Your words are so powerful. What you intend becomes true. That's what one part of hypnosis is. We'll look into it, but some of the real big names, of course, the first guy who really talked about it was mesmer, and we have a word in English called mesmerize, which started from this application. I really don't want to go deeply into the psychology part of it because you guys know much more than I do in that aspect. And I totally recognize that you guys are much more smarter than me in that aspect. So I'll keep it short there. Sigmund Freud, Milton H. Erickson. Milton was an excellent therapist and a renowned hypnotherapist. So much so that he had polio, he overcome the pain and the disability associated with it and treated himself. There are talks about his amazing power of conversation that he used, the hypnosis techniques that he implied. Then, of course, Dave Elbin, Jerry Klein, there's so many of them which basically built upon the hypnosis into their practices. Dr. Esedale was one of them. He practiced hypnosis in India, in Calcutta. He performed more than hundreds of surgeries in Royal Medical College of Calcutta. And he would do surgeries in an era when there was no anesthesia. And he would perform operations. He wrote a book about it. He went back to UK to teach it. Unfortunately or fortunately, around that time, when he started teaching, anesthesia was discovered and everything fizzled out because, yep, we like it really easy. Just whiff and you go. Then, of course, hypnosis became kind of a taboo because of all the things, the way it was portrayed in music, in the articles, a way somebody can have control over you. A lot of, just watch my watch and go back and do whatever I want. But that's not the case. So when Richard Bandler and John Grinder decided to study a couple of therapists, including Milton Erickson, Virginia Satir, and a couple of others, which included Milton Erickson was a hypnotherapist, Virginia Satir used to use hypnotherapy and was a family therapist, and rest of them, they came up with a model on how to implement it, and they decided to use the name neuro-linguistic programming because there was so much of taboo associated with the word hypnosis. They really don't want to freak out the community at that point of time. Even though in countries like UK, in America, in Canada and UK, even you can get hypnotherapy on your medical insurance. If you have insurance, you can go see a therapist and will be charged to your insurance, which is unlike the case in India where you even go to psychologists, even that is not allowed. Now, when we say hypnosis or trance state, what exactly it is? It's as with every community, I would say there's no specific definition that people agree to. But it's something which almost everyone agrees to. That's a state of human consciousness involving focused attention, enhanced capacity to respond to suggestion, and in some cases, reduced or enhanced peripheral awareness. Two things that stand out is your attention, which needs to be there, and your capacity to respond to the suggestion. Now, we experience hypnosis in everyday all the time. We're reading a book, somebody's calling our name, we are not responding to it. That's kind of hypnosis we are in. We walk into a room and suddenly we forget why do we walk in. What was that? We keep a thing somewhere else and we swear that it was there and we can't see it. That's kind of a negative hallucination that is happening to us. If you look at the Government of India notification, like most of the alternate therapies, it says hypnotherapy is a recommended mode of therapy in India to be practiced only by appropriately trained professional, and that's it. Nothing else. Yes, please. Oh. There are a couple of things that people generally ask about hypnosis. Am I sleeping while under hypnotic trance? That's the question I get a lot. No, you're wide awake, you're aware of everything that is happening around you. In fact, in most of the cases, your awareness sensitivity is more than what it would be otherwise. Second, really people are worried about it. Getting a hypnosis session is, can they get stuck in hypnotic session? Especially when you're doing some modalities like a past life regression, which is pure regression. Would I get stuck in that life? Well, no, because till now, in hundreds of years of practice of hypnosis, nobody has ever been stuck. So probably they would be put on pedestal if they do get stuck. Will I tell you any deep, dark secrets? No, it's not a truth serum. If you don't want to share it, you will not. You're always in control. There are recorded things where you can pass a lie detector test under hypnosis, which means you can fib on the parameters. If you on hypnosis telling a white lie, and it would not be detected. Is it dangerous? It's no more dangerous that, experiencing your everyday things. The only byproduct that you have is relaxation, is anesthesia, and a sense of well-being. Well, hypnosis and hypnotherapy. Hypnosis has been around for a long time. Hypnotherapy is relatively new because now we are recognizing it and using it in helping therapy. Why I would say that we should use it, as per my own experience, and I would encourage you to look for research there. It's much faster compared to other forms of therapy. Really, really fast. You get results really good. You'll be totally aware, in control of what is happening. You will remember what is happening during the session. There's no two way about it. Sometimes in deep state of trance, people do forget what happened during the session. But that's like a simple experience, because you drift on, drift off, and you might not remember, but ultimately it will come back to you. Or a simple suggestion during the session that you would remember everything would enable that. Usually from age 6 upward, you can do hypnosis. So it's perfectly safe to do with kids. It's perfectly safe to do with women in pregnancy, because if you look at Europe, US, pain-free childbirth using hypnosis is a big thing. People undergo that without using any painkiller or anesthesia, because anesthesia is one of the side effects of hypnosis. Will the therapist will have to touch you? In-person sessions, it was kind of a mandated thing that we would touch on the wrist, on the shoulder, on the forehead, because that's probably the way we were taught and we felt comfortable with. But then along came COVID, and we started doing hypnosis over Zoom, and we realized, well, we can actually do everything without touching. You can do that. So if you look at me, probably I would still, if I'm doing an in-person session, I would still, though I always take a permission that I would be touching you on your wrist, on your shoulder, on your forehead. But apart from that, no business touching anywhere else. And the touch helps, acts as an anchor. But the newer students that I have, those are doing therapy over Zoom only, and if they sometimes do in-person therapy, it's totally no contact for them. They'll simply talk it out, they'll simply click their fingers, and that's it. How many sessions do I need? My typical sessions are about 50 minutes to 1.5 hours. I typically do around 3 to 4 sessions. About 98% of my clients would be around that, 3 to 4 sessions. Fear, phobias, anything you're talking about. It's really good. From single session, I've done smoking suggestion, which is as little as single sessions, smoke suggestions happen. And I would also say I've done 10 sessions and smoking cessation has not stopped. There are various factors, because the motivation, of course, the situation one is in, those also matter. But The success rate, I would say, with smoking is if about 80 to 90% varies between them. And in a good month, it's about 90% of the patient who would see you for that would stop smoking. Will I do anything against my will? That's not possible. No violation of your moral or ethical values. You're in complete control all the times. Like everything that is dark and that fascinates human being, dark side of psychology, you would find probably 100 books on the net selling on that how to control human behavior, how to predict human behavior. And same way in hypnosis, you'll see the dark side of hypnosis. Hypnosis is just, I would say, one subset of psychology. Psychology is a very big field and hypnosis is just a smaller subset of that. So if there's a dark side of psychology, definitely there is a dark side of hypnosis. People talk about, conversational hypnosis, waking hypnosis. People talk about giving suggestions in a way that they would be accepted without people realizing that. Is that possible? Maybe yes. I have seen some people do some amazing work with the suggestions that they have. But in therapy, that's not required, first. Secondly, it's the amount of practice that would take is really high. And thirdly, politicians, priests, preachers, motivational speakers, anyway do that and we willingly go for it, don't we? So, yep, we are always mass hypnotized by the advertisements, the political parties, the religious leaders. That's fine. I think that's one way that we respond to things. Use of hypnosis in therapy. Hypnosis is more or less suggestion. So when we look at the suggestion part of therapy, we'll say it relies on the individual's ability to respond to suggestion and guidance from the hypnotherapist or psychologist in this case, while he or she is in a trance-like or altered state. Now, when we're talking about trance, if you look at classical hypnosis, there are specific ways to induce trance. If you look at therapists now, if you look at NLP, people talk about waking hypnosis. People talk about hypnosis without trance. And that's all possible. In the world of hypnosis, people are divided clearly into two areas: people who are physically suggestible, people who are emotionally suggestible. People who are physically suggestible respond to suggestion in more directive method. People who are emotionally suggestible respond to the suggestion in more permissive method. And that's the way they infer the language that is coming to them. And that's it. The method is commonly used to control or stop unwanted, unhealthy behavior like smoking, gambling, nail biting, excessive eating. Control that or enhance. What do you want to enhance? You want to enhance your confidence. You want to enhance your speaking ability or skills. So I'll take this example. I was doing this 2-day session at Chinmaya Vishwavidyalaya. And on second day, around when we started the session, there was a student who said, I have a question. I said, yes, go ahead. He said, can I speak in a British accent? I asked him, do you want to? He said, yes. Do you have somebody whom you can model? He said, yes. I said, okay, come over. So we took him right on the podium and we did a modeling process with him for about 20 minutes. And after 20 minutes, I said, okay, speak normally as you would in English. And he did so. And I said, okay, now the anchor, switch over, speak in that accent. And he spoke in perfect British accent. His resources, he did it. I merely facilitated. But he was so motivated to speak that way that it took him about 20 minutes to get from his normal accent to the British accent. People make changes. I've worked with a lady who had claustrophobia for about 40 years, one single session, and she was over with it. So I'm not saying it happens always in single sessions, but Well, we see those miracles where people are totally motivated and they say, now I don't want this shit to happen, shit being the technical term here. Research indicates the suggestion therapy may have positive, healthy behaviors, self-motivation, self-confidence. You'll on PubMD, you'll find really, really good amount of research that has gone around into this field. What is the effect of hypnosis on pain management, on pain-free birth, on other mental disorders? It's really gold mine out there. What we have, a suggestion therapy, have instant results. It's important to understand the feeling or memories associated with trauma needs to hide in one's unconscious memory. So it's typically something they don't remember. Inner child work is one of the inclusions in hypnotherapy, because most of the time when we have a deep-rooted trauma, if it's not from abuse, it goes back right to the childhood. And in cases of abuse, sometimes it does go back to the stage childhood. It's amazing to see how our mind works, take us to situations which we never even remember, and then we vividly go through it or decide not to, and then we get well. That's what matters in the end. The other part is using hypnosis as analysis. There's another branch of hypnosis which is quite active in Western culture, is forensic hypnosis, not much used here in India. Whereas analysis theory is extremely effective for digging deeper into subconscious mind. So much so that I have a couple of students who are practicing CBT for about 20 odd years. And they were very, very reluctant. They learned hypnosis and they were very, very reluctant to implement these techniques because it did not gel with the way they used to do CBT. And upon insistence, coercion, they finally agreed. And they came back and said, this feels like we are cheating, because what would take us generally 4 sessions, 5 sessions, even 6 sessions, we can do sometimes more work in a single session, going to the cause and identifying it, regressing the person to the cause and identifying it. It's so much faster. So, well, it's somewhat loss of revenue if you're doing one single session instead of 6, but the satisfaction you get giving resolution to your clients, that's something that would compensate too. Now, regression therapy is somewhat controversial, because if you look purely from the regression point of view, inner child parts therapy all works perfectly fine. Parts therapy is 6-step reframe, probably in psychology and NLP. It gets controversial on the side when we start doing PLR with it. That's past life regression. And I've personally done so many past life regressions. My take on that is that who am I to believe past life exists or not, or who the therapist is? I don't know what your mind is showing. I don't care. If it helps you get better, I would do a PLR if you believe there's something called past life and you get better out of it. Because as long as you're going to the root cause, getting rid of the symptom, that's fine with me. I'm totally okay with this. One of the best ways to do a therapy is do an induction, put them in a relaxed state, explore the past events, or choose not to explore it depending on the total behavior of the person, how good they are at responding at suggestion. There are multiple things that are. But the overall goal is to probe the individual's unconsciousness, memories of said events, so they can move past that. Now, application of hypnosis. Some kind, what we have here, I'll do kind of give you some example with each of those. I'll start with phobias and fears. My experience is about 1 to 3 session. Doesn't matter what kind of phobia or fear it is, you would be able to resolve it. Fear of cats, dogs, snakes, claustrophobia, fear of heights, though we don't ever remove fear of heights 100% ever. Cessation, addictions, hypnotherapy, especially the parts therapy in hypnosis, looks at it as a behavioral issue, and we work on the parts, those are responsible for it, and we get a pretty good result out of it. Relationship, family work, conflicts, there's an adaptation of hypnodrama, hypnochair method in hypnosis, just with a trance state, induced state. That's where we use this work. There are a couple of other modalities that you use for relationships and family work. Sleep disorders. I have a very interesting issue here. There's a woman who approached me saying the husband snores and she has an issue with it, and the husband is not willing to do anything about it. I said, I can't make your husband stop snoring, because if he's not even willing to come for therapy, what about it? But what we can do is we can work on you, and then the sound of the snoring will not bother you. And that's what we did. We did 2 sessions, and from that point onward, she started having perfectly blissful nights of sleep, because we programmed the subconscious not to be really bothered about all the snoring that is happening or anything that is happening around her. Anxiety, depression, that's where I really never commit the number of sessions you're going to take. It depends on where exactly you are. I always recommend that they see a psychologist or a psychiatrist in terms of how they think what the issue is, because I'm not certified to actually say what issue you're facing with. So I do that, but I have my own values where I say you must visit a psychologist. Weight loss sessions.
ऐसा कैसे हो सकता है कि हम जब सेम काम में पार्टनर रहे तो उनका अच्छा चल रहा हो मेरा बुरा चल रहा?
पता है उनको
क्या
वो काम करते हैं इसलिए.
I request others to mute their microphone, please. Kindly mute your microphone. Yes, Saket, you can proceed.
Thank you. Weight loss, yes, weight loss. Hypnosis is not magic. So if you are not doing a dieting, if you're not walking, if you're not doing exercise, it'll not magically do a weight loss for you. But it definitely can give you the motivation, give you the right side of, motivate, clear you of all the emotional packages that you have. Most of the eating that people do is emotional eating, so it could take care of that. It could give you a sense of reminder where you get pleasure of eating things that you really don't want otherwise, like salads or drinking more water. It can definitely induce that behavior into you where you achieve the goal quicker and faster. I have one of my students, Dr. Monica, and hypnobirthing and fertility. When I started talking about it, I myself was not too sure that it works. There was evidence. There were people who were doing it, and I had no idea. So we discussed, we talked about it, we got into the modality, how to do it, and she started practicing it. And over the, but in last 2 years, she's helped some good number of couples to actually have this ability, in spite of them, going to IVF or other methods and not being able to conceive. Using hypnosis as a tool, they were able to. I don't know. It was the whole relaxation process, the visualization process, the acceptance, whatever it was. But in the end, they got the results. And if you don't want to give credit to anything else, give credit to the effort that was put in. It's a very good exercise for ego strengthening, pain management. So ego strengthening is like you can add to confidence, add to, if you want to learn a language, if you want to have self-esteem boost, everything is possible through going through a couple of sessions, 1 to 3, not more than that. Pain management it works just like a charm. In fact, the effect is right there then. Some of the modalities that people use, there's so many therapists out there. They have specific methods like the Jacquins that I trained with in UK. They have something called arrow, the arrow technique. And you just do one session. And before the session, we do a surge scale. We say, okay, for a scale of 1 to 10, where exactly is this? It would come down. If it's on 9 or a 10, it would immediately go down to 0 or maybe 1 or 2 and not more than that. That's how powerful it is. If you do 2 sessions, you eliminate it. Of course, when we are working with pain, what we need to take care that we need to make sure that seen a doctor, and we need to make sure that in eliminating that pain would not result in further injury. So if somebody has a knee pain, I would recommend that they go to the doctor, make sure that this is something which is psychosomatic, or it's not due to the fact that they don't have a cartilage and the bones are grinding towards each other. If we remove the pain, then it's going to get worse over the period of time. Post-traumatic stress disorder, it takes longer amount of time. I always suggest keep doing hypnosis, go to your psychiatrist, go to a psychologist, take all the help, join a forum, take all the help that you can, because it does take time. There's no miracle cure for it. There's not. Yes, you would get over it. You would get over, there are studies where people have worked with PTSD, got over within 6, 10 sessions, 12 sessions of hypnosis. That's fine. But well, everyone has an individual story and it takes time. Grief and loss of loved one, that one area that hypnosis really helps trying to understand. But that's where you sometimes go into an area which is more spiritual than clinical. And if you are spiritually inclined, or even if you are not, it's a good way to release the trauma that people have about losing their loved ones. So once I have this, okay, I'll just check if you're right on time. Oh yeah, 9:41. So we'll quickly do, the next on the agenda is 2 exercises to I would request those of you who can put their cameras on, because this is something like we're going to do some exercises. So it's going to be a little bit interactive.
Yeah, people, it will be wonderful experience if you can learn by switching on your camera. So I request all the volunteers to participate, switch on their camera and do the needful. Kindly switch on your camera for the activity. Thank you.
Thank you. And as we talk about the fact that hypnosis is all about focused attention, so that is what I would request all of you to give it to me, is the focused attention on what I'm trying. I would be saying, follow the instructions and you'll see the results. So first, for the exercise 1, what I want you to do is extend your arms like this. Make sure the elbows are straight. And then a tight clasp. Bend as if you are praying, and pray if you must. And in the moment, I'll ask you to put your fingers separate about 1 to 2 inches apart and focus right between the fingers. And as you focus, I'll start suggesting that they'll come together, and they will. Separate the fingers, focus between the fingers, hands clasped. And as you do so, Feel the fingers coming together. Imagine them coming together, and they will. And as they touch, let your mind and body relax. Don't assist, don't resist. That's right. And for each one of you, it's a different experience. They would come slowly or faster, but they'll definitely and surely come. Don't assist, don't resist, and they'll touch. Perfectly fine, fine. So I've noticed for some of you, it really went fast. For some of you, it took some time, but it does happen. The second exercise we're going to do is hands straight again, about 8 to 10 inches apart. Yeah. Eyes closed. And I want you to imagine, this is basically an exercise of imagination, that your hands, your palms have attracting magnets. And the more you visualize, the faster your hand would start to come together. The magnets are getting stronger, they're coming together. Magnets are getting stronger, they're coming together. The magnets are getting stronger, they're coming together. The magnets are getting stronger, they're coming together. That's right. That's right. That's right. Perfect. Thank you very much. For some of you, it did come together. Maybe some of you did not, because we are in a way far away. But whenever you do it in person, just make sure the hands are straight and keep repeating. One of the laws of hypnosis suggestibility is repetition. The moment, because the gravity would takes the hand down, but they will not move them together. So the moment people start, imagining the magnets and you keep repeating the suggestions, it would immediately, instantly, your hands would come together.
Awesome, awesome.
Now, for everyone who has not opened their cameras, I'll still do another exercise. And we go through it on an everyday basis. The fact that we have an internal representation system, and I want you to utilize it and see how the suggestions work. What I want to do is close your eyes and imagine, visualize, and pretend that you're holding a lime or a lemon. And as you hold it, move your fingers, look at the size of the lime and lemon that you're holding, pretend. Imagine the texture with your eyes closed. And you'll be surprised that your fingers can feel the texture. Some of you would feel it really vivid. Some of you as if you're holding something, but that's fine. And take that lime or lemon, move it across your nose. Feel as you would feel, and you would get a whiff. That's right. And in the moment, not right now, but in the moment, I'll ask you to take a bite. And as you take a bite, go ahead, do it. Bite that imaginary lemon and feel how you feel. That's right. Some of your senses would actually feel, your mouth would begin to salivate. A bit or more, I do not know. But that's one of the experiences, the power of suggestions that you have. That's right. And thank you very much. And if you have any questions now, I would,
Team, if you have any question, this is the moment where we can get illuminated by by Mr. Sakit Rai.
So people, it was a fabulous session and activity. So if you have any question, feel free to ask to our resource person, Sakit ji. Guys?
Sir, I have a question.
Yes, ma'am.
So in your practice, has there ever it happened that anything adverse has taken place in which you thought should be the other way around? So are there ever any experiences that you have had, or is there a possibility that something adverse can go wrong? Like,
Ma'am, I would say an excellent question, because that's what we teach in a class. I teach a class. I was teaching my level 1 Friday and Saturday. And this is what exactly happened. What we call as an abreaction, a strong emotional response to the event when you visit. And that's the part of the training, how to handle such events. Because when you are working with people who are going back to events that has strong emotional connect, you will experience abreaction. In this case, the abreaction was so much so, the girl had a feeling of getting choked as if somebody is choking her, and her throat and her neck had visual imprints, actual bruises. So yes, and it was a good experience for the class, because usually in a class, some abreaction would happen with somebody. And that's the time you show them, hello, this is the way to treat it. Don't get scared, because if you're working, it's going to happen. And the only way that you need to do is learn and understand how to deal with it and utilize an abreaction to give, because it's a very, very heightened state. You are in a deep trance state. You are experiencing everything. That's the right time to give so many suggestions to take care of it. Yeah, Neha. Yeah, yes, please.
Yes, morning, sir. First of all, sir, I would like to ask you whether hypnotherapy can help childhood trauma patients, and mainly girls, female patients, where childhood abuse and physical abuse has taken place, and maybe patients with autism, children with autism and ADHD.
The answer is yes, ma'am. Especially in case of abuse and trauma, definitely. Hypnosis works in a way that it makes it easier for people to transition, remove, desensitize against, disassociate from that event, and come back to a normal life. Even in cases of ADHD or other things, hypnosis goes a lot beyond the regular stuff that is being done. There are a lot of practitioners around the world working on stuff which sometimes borders on, which is basically science and woo-woo, and sometimes pure woo-woo. So, but it really does not matter, because as long as it's getting results, as long as your people you're working with are getting better, I think you should do what is right for the client. So the answer is definitely yes, especially inner child therapy is the answer that you're looking at.
Thank you, sir.
And Venkat says, okay, yes, sir.
Saket sir, I have one question.
Yes, sir.
Can people do self-hypnosis?
Yes, sir.
Or so if what are the ways one should follow? Should one take the initial guidance from the expert like you and then start self-hypnosis, or how to hypnotize yourself for optimum, for mind management, or for focusing on particular goal, etc.? Can you, if you illuminate on this, I'll be very grateful.
No, sorry. So I think hypnotizing self is the easiest thing that is. And there are multiple ways to do it. I believe meditation is one of those ways. Mindfulness is one of these days, or simply the other ways that are there are, some processes in hypnosis, which done in a way, it would take you in a trance state and you would be able to work with the goals that you want to set, kind of motivation. There are so many visualization, hypnotic techniques, more focused, because something that you want to do, we have an auditory system, which is usually prominent in people, or a visualization system. So using these two, either you hear your recordings, record everything that you want to do, go through the process. Like I've been doing it for so long that it takes me like a couple of seconds to go into trance.
Wow.
So it's all about practice, I guess.
Yes,
yeah, I'm a very good subject actually, by the way.
Sir, and people are finding this session very, very interesting, and there are a lot of queries on our WhatsApp group as well as in the chat box to take your contact details and email address and other details. So please share it with the team here itself. We'll be very grateful.
I'll definitely do that, sir. That'll be a good opportunity for me. I'll just go by the answer the questions that are there.
Yes, yes.
Yeah.
Venkat says, can we reduce stress by hypnotherapy and get happiness feeling? Hypnotherapy purely believes that you can get what you want. And in fact, the first question, and sometimes the only question that I ask my clients is, what do you want? And if you can answer that, I can give you that. Stress reduction is just one of the byproducts of hypnosis. You go into a hypnotic state, stress is automatically reduced, your blood pressure would come down, your heart rate would come down. It's just a wonderful feeling. If we had more time today, we would have done about a 20 minutes hypnotic meditation kind of thing, which would have taken you all into a deep state of relaxation. There's a beautiful script by Freddie Jacquins. I have it on my YouTube channel. I'll share the link. Whenever you get time, listen to it and feel the power that our mind has. I'll not say hypnosis purely believes in the fact that a hypnotherapist is only the facilitator. Everything that is done by the client. And our job is to simply enable those processes. So we're just enabling, we're just facilitating. The results are yours and the results are wonderful. Poonam is saying, question about exercise, we have done right. What are the actual uses of these exercises in therapy? Okay, so Poonam, the actual use of exercise is to give you some amount of idea that how strong is our visualization? How strong is the suggestion? Were there actual magnets? No. Your hands moved? Yes. How? Your thought process is controlling the physical reaction. There are other ways which basically controls the mental reaction that you have. Everything that we have is a reaction to the input. Pavlov proved it in his theory, in his practice. If we are conditioned in a way, the way we are brought up, the way we experience the word reality, we can change the way we experience, the way we can respond to it. Definitely we can. So that's a basic idea to give you how powerful it is. You can actually physically move your hand. It can do a lot more. Yeah, Sanjay ji, you have a question.
Two questions, in fact, sir. One is what kind of...
Others, please mute your microphone. Sanjay ji is asking question. Let's not disturb each other. Sanjay ji, please go ahead.
Thank you, sir. Two questions, sir. One is, what kind of person would be an ideal person to become an hypnotherapist? And what kind of person would be an ideal candidate to be a subject for hypnotherapy? So I'm trying to understand a profile here, which is most suited, that kind of thing. Thank you, sir.
So, in addition to that, there's a connected question in the chat which says, can anyone be a hypnotherapist? Like, can anyone learn hypnosis?
That's the next one. Yeah.
Yeah.
Ramba ahead. So
Yeah.
I'll answer both of them. Sanjay's question, Ramba's question. Yes, anybody can learn hypnosis, and there are no special abilities needed. None at all. Yes, since I say anybody can become hypnotherapist, yes, they can. What I believe is that who all should learn it? Psychologists, psychiatrists, doctors working in emergency rooms, people who are in caregiving, people who interact with people, lawyers, policemen. Our words are very powerful, very powerful, and we don't realize it. And when we understand the power of suggestion, when a person walks into a psychologist's office, the mere fact if the psychologists tell him, I've worked with people who are like you, and you probably fit the profile where there's a 90% to 95% of a chance that it'll get over within a month. Placebo is because you have that kind of authority. When you give that suggestion, the person believes it. And if you look at the diagnosis and say, oh shit, well, sorry, gone. That guy is not going to recover. Not with you anyway.
Yes, sir. I totally second your thoughts, because many a times placebo works like wonders. Small issues people overcome just by the confidence a psychologist put in. कि ये तो कुछ है ही नहीं, ये तो बहुत छोटी सी problem है, and a person resilience get a, it gets a boost. So very well suggested, sir. Thank you.
Then I'm taking Mr. Srivastava's question. Thank you. Yes, you can connect with me. There's nothing called best hypnosis course. I believe in the fact that you should do it with somebody where you can get physical sessions, where you can get online sessions. I would also suggest that go to as many teachers as you can. I've done that. I've learned with David Snyder. I've learned with my teachers here in India, Dr. Preeti. I've gone to Jacquins to do my professional hypnotherapy. I've done Mike Mandel in Canada. I've done Igor in US. Go to as many people as you can. I've gotten hold of old books, old video recordings, Milton Erickson being my favorite. I've probably heard him a lot. I've read so many psychology books. I would probably qualify as some half-baked psychologist now. I still have a lot of reading to do. And on influence, on behavior, on why people work, Robert Cialdini being one of my favorites, on persuasion and influence. Amazing amount of work on human nature, how to influence people. And if you actually look at psychology, one part, hypnosis, the way we do is treat people, make them better is purely by influence and persuasion. We're not giving them anything. We are just persuading them to get better. And voila, they do get better. So we do have those magical qualities in ourselves. Our words can do wonder.
Yes.
The hypnosis can help to remove the illusion of the patient and the client. Yep, any kind of illusion that you are in. After all, illusion is a belief system. And hypnosis is all about changing belief systems. Psychology is all about changing belief systems. And we are nothing but our belief system. So what we believe becomes true. That's also true. Thank you, Poonam. Thank you, Ramba.
No, Sheru has raised hand. I think the anchor has some question to ask.
Yeah, please. Oh, sorry.
Yes. I was just waiting for my turn, sir. Okay, so how do you decide that this patient is fit for a past life recreation, or how do you decide on a patient as to how the treatment of hypnosis be followed? And my second question is, have you come across any unexplained phenomena when you treat hypnosis, or when a patient reacts in a very different manner, which does not have a scientific explanation?
Yes. And yes, and now let me tell you. So the past life sessions, I look at people in two different ways. One, who want to experience past life as a tourist. They just want to experience it. And when the tourists come to me, I say, well, sorry. Unless you have an issue, I'm not taking you, but I'll give you the number of somebody who will take you on the tourism job and do it for you. Secondly, yeah, that's my personal belief, because I say because a lot of these people have seen movies, have looked at things, and they have a certain set of expectation. It's not therapy. It's a 4K movie of seeing themselves in a set. And I said, go back, write your own story. That would be perfectly fine for me. So if you don't have an issue, no. The people who I work with, either they regress to something, a point in time, which they don't recognize from this life. They're dressed differently. Sometimes they have a different name. Then we think it's safe to assume they are in a different life, or they're experiencing something which is can be a metaphor for a different life. And or sometimes when we're working with issues and we're not able to resolve that issue, then we give a suggestion like something, go to the root cause of this issue under the trance state and go to the point in this time or any other time, in this life or any other. That's suggestive, but that's the probably only suggestion we give in terms of people still might land up in this life. Unusual phenomena, many. I don't know what to call them. So I don't call them anything. But people who experience them, they call them entities, they call them spirits, they call them. I'll take a very interesting example. Like during the COVID times, I got a message from a girl and she said, my mom has started behaving differently. She's abusing people, she's kicking people, she's never this way. And now I really have an issue with the family that how's that happening? And I was like, okay, let's see what we can do about it, because I'm not too sure what I can do unless you go back to a psychiatrist and come back to me in terms of what exactly the issue is. Well, they went to a psychiatrist, they came back, they said the medicines are not helping. So I said, okay, come over. But before that, send me what the diagnosis is. The diagnosis was religious dissociative identity disorder. Fair enough, I've dealt with it, seems like a parts issue to me, and we can do that. So we started working, the session started. We regressed to the cause, to the fact, the time when for the first time, she started experiencing those episodes. She went inside, she said, she has a voice, which is not her own. She identifies not her own, it's a male. And that male is directing her to do things. We connect with the male, we start interacting with it, where you came in, what exactly are you? We're just trying to give a form to what her projection is. And then there was another voice that she was hearing during the conversation. So there were 3 people talking in her head, 2 male voices, 1 female voices, and both of them telling her to do things. We regressed her further. She realized that she has been to this mazar and this voice came in here. She has been to this mazar and this voice came in here. We were still struggling, unable to find. I told them it will take 6 sessions to get resolved this issue. And still, first session, we're totally struggling. And by about 2 hours past the mark, suddenly, in the conversation, it comes out that one of them is disciple of Haji Ali Baba in Mumbai. Peer Haji Ali. I said, okay, fair enough. The other one says, okay, I am also the disciple of the same. And the lady, also had visited at one point of time that shrine. So we took her mentally to that place. And then she started hearing voice of Haji Ali Baba. And that voice, we requested that voice to do the right thing and ask these voices to leave her head. And the voices left, the session ended. Perfectly fine, she was feeling great. After a week, I got her daughter's message that she is fine and everything is good. After a year, I got her, I never expected it. After a year, I got her daughter's message that she never believed in anything like this, but now she understands the things beyond what we look in everyday life. So if you look at the clinical side of hypnosis, it's purely a parts issue. If you look at the spiritual side of hypnosis, it's an entity infestation. Like always, being on the good side of it, I say, I don't know what it is, but I don't care because it resolved the issue. So if people want to call it entity, I'm good.
So thank you very much. Thank you very much, sir. I would still request you to please post your email address and contact details, website, etc., so that our participants and more who will see this recording, they may contact you and enroll for learning hypnotherapy sessions and courses.
I'll just share the screen, sir, and on the last slide I have that, and I will also send you the details so that These are
Yeah.
my details.
Because this video will be played to the students of DU, Amity, and others. So in the last slide, if we can have your email address, website, or contact details, it will help the budding psychologist.
Yes, sir. I have it here, and this is the one.
Yeah. Thank you so much, sir.
Thank you very much, sir. Thank you very much for giving me this opportunity.
So you are always welcome. We would like to have your in-depth session maybe sometime later. And thanks for illuminating, Saket, sir. You have actually left us spellbound. Maybe it's a kind of a hypnosis.
And thank you, sir, for taking out time and conducting this session. Dr. Toshedra Dwivedi, thank you very much, sir, for getting Saket Rai, sir, on this forum. And we are so
Yeah,
much
Thank you.
enlightened, and all this myth and about hypnosis are debunked, and we got a very insightful, knowledgeable session. All thanks to both of you.
So thank you, Sheru, Reeba, core team of Young Psychologist of India, Alok ji, NP Singh sir, Seema, and everyone else, Dr. Rishi, Sandeep, etc. Thank you once again, Saket ji and Ramya. I'm very grateful to that very dynamic lady who has made all this. She was the bridge over the floating waters. Ramya ji, thanks to you too. So once
Sir, this is Ramya. Sir,
Ha.
this is Ramya. I
Ha.
want to thank you. Actually, sir, that was the first time that we spoke, and and you were so kind, and I mean, it's very rare to find a person like you. So, thank you so much for this
Thank you, Ramya
encouragement.
जी. We
Yeah.
all are team, and अब जुड़ गए हैं तो जुड़े रहेंगे, और साकेत सर से और आपसे हम लोग together we will make sure that we can bring about a positive difference in the society. We can contribute and we can heal thousands of people. We can illuminate
Absolutely.
also.
Yeah. Thank you so much. Thank you, sir. Thanks for the
Last
opportunity.
word from Saket sir, then we will wind up.
Again, I'll take this opportunity to thank Dr. Dwivedi. Thank you very much for allowing this. I would like to thank Ms. George, Mr. Alok, Sheru, and especially Ramya for making this possible. And thank you everyone for attending the session. In case you need any clarification, you want to get in touch with me, please feel free. You don't have to be my student to clarify your questions. I really, really love speaking about this topic. I really love sharing the things that are possible. So I would reply, I would respond as soon as I can. Thank you.
Thank you, sir. Thank you. We are waiting for the recording. आप मुझे share कर दीजिएगा, because publicly we share it only to those who demand it, and
Right.
otherwise our core team will keep it, and we will share it to the university students as and when it is required, sir. Thank you
Right.
once again for coming and illuminating us, Saket ji. We will be in
Thank you.
touch.
Thank you.
Bye. So bye all of you, all the viewers. Hope you find this session wonderful. We'll see you all next Sunday at 9 a.m. again. Thank you, Ramya ji, and all volunteers, Reeba, Sheru, our usual question putter, Sanjay ji, and all. Thanks for making this team and a big team. Bye and happy Sunday, all of you. Namaste. Namaskar.
Thank you, everyone.
Thank you. Thank you, everyone.
Thank you, everyone.
Thanks a lot.